5 things that Medicare does not pay for. Medicare doesn't pay for everything. So in this video, I'm going to explain those 5 things. There are 5 things that it will not cover that you probably thought that it would. Hi, I'm Cheryl Scarlato. I'm with Senior Solutions Group, also known as SSG Insurance. And most people that aren't on Medicare yet assume that Medicare is going to cover the whole body, right? It's Medicare. It's your health care for the rest of your life, and it's going to cover the whole body. But it's not. It does not cover your teeth. So if you've never had a dental issue, you're going to be shocked. You're going to be completely horrified how much one bad tooth can cost you. One tooth can cost you up to $3,000. So if you've had a whole bunch of teeth going bad and you've never had it before, you're going to be in a world of hurt. Thousands of dollars of hurt. So because Medicare covers 0 dental. Now, I know you've heard a lot from the Biden administration in the past few years and on the stump prior to the election how they were going to give us dental benefit. And I know that's something that Bernie Sanders talked a lot about too. And we all thought it was coming. The newspapers made it look like it was coming. The news made it sound like it was a done deal. And then we didn't get it. It didn't happen. So if you aren't staying up to date, I'm here to tell you we don't have a dental benefit still. When we've never had one in the 56 years of Medicare, and we still don't have one. So it won't cover cleanings, it won't cover dentures, implants, crowns, root canals, nothing at all. No dental. Your dental health is a good precursor for your overall health. And we know more and more about that every single day. So it's important that you do get some kind of dental care. But before you're gonna have to buy it on your own. Now, some Medicare Advantages do have a dental benefit. It's one of the reasons why it's become so popular. But it's just the basics. Or you can buy your own just dental plan, which we do sell a lot of those. So if you're interested, give us a call. So again, Medicare doesn't cover dental. It also doesn't cover vision. Now, yeah, it has a little. It will cover cataracts. It will cover glaucoma. Or if you've had macular degeneration due to diabetes, it does give you some coverage for that. But it does not give you any coverage just for an annual eye exam, okay? Now, that might cost you $125 at least. And it will not cover glasses, contacts, and it doesn't cover anything cosmetic, which kind of goes also into the vision because it doesn't cover LASIK. And I get that asked a lot. Nothing cosmetic. Now, if your eyelids are droopy like mine and it's obstructing your vision, Medicare will cover that. But if your eyelids are just droopy and you're starting to look old and you're like, I'm starting to look old, they're not going to cover it solely because it's cosmetic, which can mean like varicose veins. If you can't breathe out of your nose, that's a deviated septum. That's medical. But if you don't like the look of your nose, Medicare is not going to cover that. No cosmetic. So no dental, vision, cosmetic. Now let's talk about hearing aids. Hearing aids are something else. Until you need one, you have no idea how much they cost. Really good hearing aids in the last couple years without any insurance, when I had to go get them for my husband, they cost about $7,000. Which he then promptly decided he was going to go dive in the pool, and he ruined his hearing aids immediately. $7,000. They're the little things they're little and they can fall out and they are expensive. I've had clients call me saying that they've lost them, couldn't find it, got stuck in the under the couch and got kicked somewhere and then they couldn't find it. And they're expensive to replace. So now some Medicare Advantage plans, they do offer some great discounts on hearing aids. I know one company that was offering about a $400 copay per year, which is a really, really good deal. But Medicare itself has no benefit. If you have original Medicare, just A and B, or if you have a Medicare supplement like Plan G or Plan N, there is nothing in there to give you an audiology exam to see if you need the hearing aids. And there's nothing to cover the cost of the hearing aids. So that's dental, vision, hearing, and cosmetic. Now the last one is a really big one, and that's nursing home care, long-term care. Most people assume since they go together and that they're going to be of Medicare age, that their Medicare is going to cover. So if you go into a nursing home, and it's just really not true if you want comprehensive care, home health care, adult daycare, skilled nursing care, you have to buy your own insurance, which we do. We do sell that, but we do sell that inside of a life insurance policy, and that's called a living benefit. But if you buy Medicare, original Medicare only, you just have what the government gives you. A and B, very, very little coverage at all for the nursing home. So if you buy a Medicare supplement, if you have Plan G or Plan N, I remember my agent told me something that I'd have a little coverage in a nursing home. Well, that's true. You could get up to 90 days covered, but there's very strict requirements to get there. First, you'd have to be in the hospital, admitted, which that can be on its own a big hurdle. You have to be admitted, not under observation, overnight for 3 overnights. So if you're there for 3 overnights and then you're discharged to skilled nursing, which means you got to have medical care available 24 hours, then they can pay up to 90 days. 90 days is not very much. And I said can in parentheses because there are certain requirements to get them to pay all the way up to that 90 days. You might only qualify for a week or 2 weeks or a month. So if you really want nursing home coverage, don't expect it to be under your Medicare. It's something separate that you're going to have to buy on your own. So those 5 things are 5 biggies that if you're not on Medicare, you're going to come up with a big shock, huge holes in your retirement plan. So we can help fill them. So give us a call at SSG Insurance. You can look in our bio for our contact information. Look below this video. Better yet, book an appointment with us so that it can be on both of our times. I also have some cheat sheets on some of the data for Social Security and Medicare for 2024. You can download it. That can help you. If you have any questions at all, give us a call. Let us help you with those difficult decisions. Check in the description below this video for a link to our cheat sheet. It's the cheat sheet on our Social Security and Medicare. And you can also give us a comment and I will respond. If you have a specific question, always feel free to give us a call or email us at ssgmedicare@gmail.com, or better yet, book an appointment. I look forward to speaking with you soon. Have a good day.